Hi guys, this is Dr. Central Psych. I'm an adult psychiatrist who focuses on addiction medicine. I help those with psychiatric illnesses and addiction disease find a pathway to recovery. You can follow me on www.facebook.com/DRCYNTRELL site. Today this is part two of my discussion on the opioid crisis in children. So last week I discussed newborns and pregnant mothers and the risk of using opiates during pregnancy. Today I will talk about how opiate use is affecting children directly and indirectly in the U.S. currently. So recap from last week, as I said, over 2 million Americans are addicted to opiates, and that the overdose deaths have quadrupled in the last 15 years. So addicted adults oftentimes have a lot of things to deal with when they're dealing with their disease, such as the stigma of the use. They also have to worry about the withdrawal symptoms, also being punished legally for their use. But oftentimes we sort of miss that, most of these adults have children. So how are their children affected? And how are children affected in general with opiate use? So this series discusses opiate crisis and children. Today I will focus on toddlers and adolescents and the ways that this crisis is affecting them. So last week, recap, I discussed that every 19 minutes, a newborn is born with dependency on opiates. So when a newborn is born with dependency of opiates, they usually go through withdrawal, which is called neonatal abstinence syndrome. And they have to be put into the NICU, and they are tapered from the substance with a substance similar to that, most likely a long-acting, such as methadone. So they're usually more fussy, more irritable. They have poor ability to gain weight. So they have feeding issues, and then they have actually a prolonged stay or a stay at all in the NICU, which is not required for all children. So those are the effects of the infant. So let's talk about toddlers and children. So the rate of opiates being prescribed to children has doubled in the last 15 years. So kids are now being directly prescribed opiates. Also, the number of Americans abused also includes children under the age of 21 being addicted to painkillers or heroin. And the illicit drug abuse in teenagers is about 79%. And the death rate for them, because their bodies are smaller, is almost 100% when they're overdosed. So let's talk about the children. I'll break it down into 4 types of kids. One, let's talk about the kid who's exposed to heroin or drugs because their parents are addicted to the substance and they overdose. So in the news you will find that if you Google opiate crisis and overdoses, you'll find some articles that discusses when parents are driving their kids to school, and then they find the parents and the kid in the car. The parents are slumped over because of ingestion of opiates, and the kid's in the back seat. Usually that parent is arrested and then charged with whatever they're charged with. I'm not a lawyer. What I was reading in the article was endangerment of children, possession, etc. And then what happens to that kid? Well, now that kid is more than likely going to be taken away from that parent and put into the custody of either the grandparent or foster care. So that's one way kids are exposed. Another one that's increasing over the last 5 years is that kids are being brought into the ER with overdoses. So let's talk about that. So toddlers are touchy. They touch everything. They get into your purse. They touch the stove. They touch everything. So what is happening is that parents or grandparents have the prescription drugs, or they have prescription drugs, but they got them illegally, such as buying them on the streets, or even they have heroin and they have needles around the house. So these kids are now, they're touchy. They put everything in their mouth, and so they're ingesting these opiates. And then their little small bodies can't handle that particular dosage. So now they're overdosed. So now they're presenting to the ER, having to do the same procedures as we do for adults who overdose Narcan. And then we have the situation where now we have a kid who's used opiates and now is sick because of the overdose. And that's unfortunate. Also, another type of kid, a child, an adolescent, a teenager, is the ones who are actually unfortunately sick themselves, in a sense where maybe they had a major surgery. I've had a lot of clients tell me they had an injury in football, hurt their finger, hurt their knee, they were prescribed opiates. Then that just spiraled throughout their lifetime, or their course of their life, so now they're addicted to opiates. Or sickle cell. Sickle cell is often, their pain crisis is often treated with aggressive hydration, aggressive oxygen, and also aggressive pain management. So now these patients likely will develop a tolerance for opiates, and maybe when they're having, they know that opiates will help their pain because that's what they've been treated for in the past, and that's what worked. So now they're using it themselves, and maybe they may develop an addiction. Also, peer pressure. So let's talk about peer pressure. Peer pressure is an issue with teenagers in general. So maybe you're in your primary life, you're not exposed to drugs. Maybe you are, but then your friend is using something, and they're like, "Oh, do you want to use this too?" So all of a sudden, you're using substances that you shouldn't be. So with all of that, let's talk a little bit more about the children with pain issues. There is truly a balancing act between treating their pain and trying to prevent or even treat opiate addiction. So I'm not saying that children shouldn't be prescribed. Well, maybe they shouldn't. That's a pediatrician decision. Shouldn't be prescribed dosing of opiates, but there is truly an act where you have to balance, well, how much of this do they need? Do they need to be prescribed outpatient? Do they need to have multiple pills throughout the month to control their pain, or could they be limited to 7 days or whatever? Or also, how will this affect them in the long term in their life? So that's some things that we need to think about when we're thinking about the opioid crisis in children. So what brought about this topic and my thoughts about children who are affected by the opioid crisis is that recently there was an APA, American Pediatric Academy study that showed that more kids are being brought to the ER in various ways due to opiate overdoses, or even just testing positive for opiate use. So they found in the study that in a day, an average of 135 children was testing positive for opiates. And then when they further investigated that, they found that most of them were also addicted or dependent on the opiates. And that's alarming because, we have a crisis. Kids grow up, and that will further them. That would go further into their lifespan. They won't be kids anymore, they'll be adults. So these are the issues that are currently facing children in our day and age with our public health emergency with opiates. So we definitely need to try to balance treating kids for their pain, or even treating their parents for their addiction, with also trying to prevent and treat the disease in general. So this is Dr. Centrell Psych. I'm an adult psychiatrist who focuses on addiction. I help those with psychiatric illnesses and addiction find a pathway to recovery. You can follow me on www.facebook.com/Dr. Centrell Psych. I look forward to discussing another topic with you later on. Thanks. Bye-bye.